Hello, and welcome to another new episode here on the Fact Factory podcast, the podcast where we dive deep into the truth and trend shaping our world today. And I'm your host, Ishmael Jimazam. In today's episode, we are joined by
Thank you very much. My name is Tony Kazia,
a health expert who is going to tell us more about the suicide. As you already know that here in Malawi we have a lot of cases about suicide. So welcome. So how can you define suicide?
A suicide is when people harm themselves with the goal of ending their life and they die as a result.
So what can you say about the suicide attempt?
This suicide attempt, this is when people harm themselves with the goal, of ending their life, but they do not die.
So can you tell us the people who are at risk?
Everyone, all genders, ages, and ethnicities can be at risk for suicide.
Okay.
Everyone.
So can you tell us the many risky factors for suicide?
We have so much.
Okay.
They are very numerous. A history of suicide attempts. We're talking about depression, other mental disorders, or substance use disorder. We have chronic pain, family history of a mental disorder or substance use. We're talking about family history of suicide.
Yes.
There's exposure to family violence.
Okay.
Including physical or sexual abuse. Another one is presence of guns or other firearms in their home. Having recently been released from prison or jail. Yes. And in addition to that, exposure either directly or indirectly to other suicidal behavior, such as that of family members, peers, celebrities. It is also the risk factor.
Okay.
We're talking about most people who have risk factors for suicide will not attempt suicide, and it is difficult to tell who will act on suicidal thought. Although risk factors for suicide are important to keep in mind, someone who is showing warning signs of suicide may be at higher risk for danger and need immediate attention.
Alright.
And also stressive life events, such as the loss of loved ones, legal troubles, or financial difficulties, and interpersonal stressors, having as shame, harassment, bullying, discrimination, or relationship troubles may contribute to suicide risk, especially when they occur along with suicide risk factors. Okay,
you have explained a lot. So what can be the warning signs of suicide?
Warning signs that someone may be at immediate risk for attempting suicide. Talking about wanting to die or wanting to kill themselves. You will hear some people, about taking their lives.
Yes.
Like killing themselves. Some of other people used to say when they are in danger for something else, when they are in trauma, when they are disturbed, when they are psychologically disturbed. Other people talking about this, talking about feeling empty or hopeless, having no reason to live.
Alright.
We're talking about feeling trapped or feeling that there are no solutions. This is the lack of hope. You might face some challenges and then feeling like I'll never get out of this. So if you see that person, this is also the sign. We're talking about feeling unbearable emotion or or physical pain.
Yes.
Talking about being a burden to others.
Yeah.
Withdrawing from family and friends.
Yes.
Giving away important possessions. Saying goodbye to friends and family. Some people says goodbye for no reason. Like, where are you going? You don't have even the trip. You don't have even place to go. But just to say goodbye, like, you never come back again. So. Okay, this can be also the sign of suicide. This is the sign because that person think of something else. Might think of killing himself. Putting affairs in order, such as making a will. Yes. Or talking about taking great risks that could lead to death, such as driving extremely fast. Driving, this is unusual driving. Talking or thinking about death often. And the other serious warning signs that someone may be at risk for attempting suicide include displaying extreme mood swings, suddenly changing from very sad to very calm or happy. Another one is making a plan or looking for ways to kill themselves, such as searching for legal methods online. Yes. Stockpiling and pills, or buying a gun. Other people take their lives just to shoot themselves, pulling the trigger in their head, like. Talking about feeling great guilt or shame. We're talking about using alcohol. This is also the serious warning. Using alcohol or drugs more often. Acting anxious or agitated, changing eating or sleeping habits. Yes. Talking about showing rage or talking about seeking revenge. These are also some of the serious warning signs that someone may be at risk for attempting suicide. So, can you tell us about the treatments and the therapies which are there to help the people who want to commit suicide or who try to commit suicide? Effective evidence-based intervention are available to help people who are at risk for suicide. The first one, this is cognitive behavioral therapy. CBT is the type of psychotherapy. Yes. That can help people learn. New ways of dealing with stressful experience. CBT helps people learn to recognize their thoughts patterns and consider alternative actions when thoughts of suicide arise. The second one is dialectical behavior therapy. Yes. DBT. DBT is the type of also the type of psychotherapy that has been shown to reduce suicide behavior in adolescents. DBT also has been shown to reduce the rate of suicide attempts in adults with borderline personality disorder. A mental illness characterized by an ongoing patterns of varying moods, self-image, and behavior that often results in impulsive action and problems in relationship. A therapist trained in DBT can help a person recognize when their feelings or actions are disruptive or unhealthy and teach the person skills that can help them cope more effectively with upsetting situations. Yes. And the third one is brief intervention strategies. Research has shown that creating a safety plan or crisis response plan with specific instructions for what to do and how to get help when having thoughts about suicide, can help reduce a person's risk of acting on suicidal thoughts. Staying connected and following up with people who are at risk for suicide also has been shown to help lower the risk of future suicide attempts. And the research also has shown that increasing safe storage of lethal means can help reduce suicide attempts and deaths by suicide. And in addition to that, collaborative assessment and management of suicide risk can help to reduce suicidal thoughts.
Yeah.
The fourth one is collaborative care.
Yes.
This is the care team based on approach to mental health care. A behavioral health care manager will work with the person, their primary health care provider, and mental health specialist to develop a treatment plan.
Yeah.
Collaborative care has been shown to be an effective way to treat depression and reduce suicidal thoughts.
So what should I do if I'm struggling or I'm stressed, or if someone who I know is stressed?
The good question. If you notice warning signs of suicide, especially change in behavior or new concerning behavior, get help as soon as possible. Family and friends are often the first to recognize the warning signs of suicide, and they can take the first step towards helping a loved one find the mental health treatment. You know that in our everyday life, we get close to the family and the friends in everywhere we go. So these are the first helpers. These are the first people who can give the first treatment to you and showing you some advice. So if someone tells you that they are going to kill themselves, do not leave them alone, and do not promise that you will keep their suicidal thoughts a secret. This is the big issue. Don't keep it a secret, because this can influence this behavior. So tell your trusted friends or family members or other trusted adults to help.
So what if I see a suicidal message on social media?
Knowing how to get help when someone posts suicidal messages can help save life. Many social media social media sites have a process to get the help for the persons posting the message. To learn more, visit 988 Suicide and Crisis Lifelines webpage about safety and support on social media. So if you see messages or live streaming content that suggests someone is actively engaging suicidal thought, you can contact the safety teams at the social media compound. They will reach out to connect the person with the help they need. Studies have shown that asking people about suicidal thoughts and behavior does not cause or increase such thoughts. Asking someone directly, are you thinking of killing are you thinking of killing yourself, can be the best way to identify someone at risk for suicide.
Okay, let's assume that asking someone that you want to commit suicide, can that person be able to answer that yes, I want to do so?
It happens. It happens. She can say yes. It just depends on the mood of the time, but she can say yes.
Okay, so do other people say I want to commit suicide to get attention?
Suicidal thoughts or action are a sign of extreme distress and an indicator that someone needs help. Talking about wanting to die by suicide is not a typical response to stress. All talk of suicide should be taken seriously, and it requires immediate attention.
Okay, so can you tell us how suicide rates differ from different